shower stains.
Hello, focus. All right. Is this recording? This is recording. Oh, for God's sakes. Okay.
Are we good? Yeah, I see.
Well, let me. All right, talk into that.
Hello.
Okay.
Okay.
Oh my God.
This is weird. I feel like
Naked?
I feel naked. I'm naked, everyone who's not seeing this and just hearing this. My ears are uncovered. I don't have my headphones on.
We have been, well, by we I mean me, just because I think that I know how to be our producer, and then I go to garage, I call it garage center, it's guitar center. I go there often and always. I'm gonna have to hit up my boy HB and be like, what's happening?
Good though. Like your brain at least can function in that capacity.
Can it though? I don't know. We just fumbled around for like 10 minutes because Sarah's headphones aren't working and we don't know why. Anyways, people don't care about that. How are you?
You know, I am pretty good. I know we were gonna have this episode and just to talk about our lives and what's new. No special guests today. You guys just get me and Bree.
I know. When you walked in, I said I feel like it's been a minute since it's been just the two of us.
Yeah, so things have been okay. How about for you?
Things have been okay as well. I'm confused because we're like a week behind. Where season 1 we were like very current and when we were recording and when we were pushing out episodes, which has been a little bit easier for me, like from an editing perspective. But the most recent episode that you guys would have heard was Christina, and I don't know about you personally, but like I got so much feedback on her story.
I know. Yeah.
Like, and you kind of explained it to me, and I met her when we went to that event. Like it was some breast cancer, I think, like a breast cancer awareness event in October that we went to together. And I met her, and I remember you saying she went through chemo when she was pregnant, and like I guess maybe it just didn't fully settle in on exactly how that looked, or just like her cold capping and all of that. But I mean, I can't, I'm still mind blown by her whole story. So.
I know, agreed. And to find out both of those things within a week of each other.
So yeah, and I was talking to my mom about this because she just listened, and she said, and this is a good point, and maybe hospitals have this and I just don't know about it, and I think there are maybe like some kind of, not like, because I don't want to call it a support group, but it's more like almost like an open adoption, but for cancer patients, where like
a sorority sisterhood.
Kind of, if you're diagnosed or if you're going through it, like your oncologist could ask the question, are you open to me sharing your contact information with anybody else that maybe has a similar story or similar diagnosis if they're looking for support? And then that's like essentially a hospital database where if you want that or you're asking your doctor for it, they can put you in contact as long as both parties are like comfortable with it.
I think that's great. I think it's happening now, but like underground, undercover, right?
Right.
Like how many people have we sponsored or sponseed?
Right.
And, you know, I don't talk about my sponsor enough. I actually was reflecting. I thought about her this morning, Michelle. She's my best friend's cousin, diagnosed with triple negative breast cancer a few years before me, found out, and we ended up developing the most beautiful friendship. Yeah. She texted me or called me literally every single day for like 2 years.
That's amazing.
And it takes a lot, and it takes a lot of time,
lot of work,
and it can be re-triggering, and I think that there's a lot to be said about that in those relationships. You know, we have like an unspoken sisterhood. I'll always feel connected to her, but I would love for there to be a program that it's more public and like a match site.
Exactly. Like they literally match you up based on certain criteria. And I feel like there is something kind of similar that the clinic does. I remember my friend Amanda telling me about this, and I can't remember exactly what the details are, but I feel like it would be really helpful. And then, I mean, local obviously is preferred, but maybe if there's not, because I feel like Christina's situation was very specific, and I don't really know how many people go through what she went through.
Yeah. You know what? I'm going to bring this up next week. I meet with the nurse practitioner for my 6-month just general checkup, surgery-wise, at the breast center, and I'm going to talk to her about it. She's like a nurse survivorship navigator, so she meets with you after you're done with treatment once a year, and I just stagger her appointments with my general surgeon. And yeah, so I might bring it up to her and see what she says. I'll report back. Yeah. I'm going to collect some evidence.
Well, so is that the same day that you're getting your scans?
Yeah, so do have my scan scheduled at the end of the month, so by the time this episode gets pushed out, it would have already came and gone. So I'll make sure to keep you guys posted. You know me, I'm an open book. I'll just share and everything. But yes, my scan is on Wednesday.
How are you feeling?
You know, it's funny. So I went to therapy a couple weeks ago, and we talked about like what my coping skills are in really like stressful times or times that, you know, I feel very vulnerable, and it was distraction and dissociation.
Is your coping?
Yes.
Okay.
So, and then I was kind of chuckling to myself about this on the way here. I've literally reorganized and purged my room and my children's rooms. I'm cleaning out my attic, and then Phil and I decided we're gonna do some spring projects, like ripping up carpet and repainting our entire house.
Love that.
So
that's a good way to like
any education of how I'm doing.
I actually, but would you consider that distraction, or would you just consider that keeping yourself busy? I get maybe keeping yourself busy is a form of distraction, but when I think of distraction, I think of I don't know, maybe unhealthy ways of distraction.
Okay, well, good. No, these are constructive things that need done anyway.
Constructive and construction, apparently, for you.
Phil's like, whoa, you want to do this all next weekend? I'm like, yeah, let's go.
Do you get hyper-focused too, where you're like, no, we have to do it now. I don't want to wait. Yeah, I'm the same way.
I'm like, well, hi, Sarah. This has been the way it's been since I've moved in. Why do I want it fixed next weekend? Like, take a chill pill.
This was like when I had to have this chair in this room for our guests, and I like braved the snowstorm by myself in my storage unit and was lifting this chair over a table, and Rocco was like, you couldn't have waited an hour for me to help you. I was like, I literally couldn't wait.
Oh my gosh.
Like it was, when I get my mind on something, I'm the same way.
It is a beautiful chair.
Oh, thanks.
You are welcome. For any guests that are going to be on, like, it's a very beautiful chair. You'll be honored to sit in it.
Yeah, thanks.
Yeah. So I think I'm okay. Claire hasn't made any more comments about me dying. So there's that. She's really sick now too, though. I'm taking her to the doctor after this. This girl.
Kids cannot get, like, they're just passing it back and forth, it feels like. Because wasn't Ben sick for a minute too?
Ben was sick, now Claire's sick. So
how's he doing?
Distraction.
Post-surgery, by the way.
Yeah, Ben had a birthmark cut out of his head. Sorry, word jumble. And he's doing well. Yep, he's healing up from his scar. And so he's doing good on that front. And yeah, so scans on Wednesday, and
feeling good?
Yeah, feeling good. I'm more short of breath in general at my workouts than the other people there, which I'm just maybe out of shape. Like, I need to just suck it up and say, Sarah, you're out of shape. It's not because you have anything wrong.
I think that you are in shape. I just think that we struggle because of radiation. That's my excuse.
And I do have scarring in my lung from radiation.
Yeah.
So I'm sure my oxygenation possibly is not as
Is that what it oxygenation?
I think maybe.
You're the nurse. I have no idea. I just have never heard that before. Okay. I had my checkup with my doctor last week, so I feel like a big week for the two of us health-wise. I went in like I always do, and that's just very nervous to be back there. I told people before I also have osteoporosis, which moved to osteopenia. I'm pretty excited.
That's great. Okay, well, will you explain that a little more for maybe people that don't know the lingo?
Yes. So I had to get a bone density scan in November of 2020 because the medication that I'm on can weaken your bones. So they wanted a baseline to determine this is where your bone density started, and then we're just going to monitor it every 2 years to make sure that it's not decreasing because of this medication. Well, when I went in for that scan, the doctor was like, you've been in osteoporosis prior to cancer diagnosis. Like, there's no way that it would have gotten to this level of density or lack thereof in just like the 6 months that you've been on this medication. So because of that, I went on an infusion that I do twice a year. It's like a drip IV, and then I just lined it up with when I would see my doctor, because I was seeing my doctor, well, at that point I was seeing my doctor every 3 months. So, and I was like, had a really hard time with it. I was really frustrated. It just felt like one thing after the other. And now looking back, and I went back and actually listened to our survivorship episode and our coping episode, just to make sure that I'm not repeating information, because today we were kind of looking to talk about like some boundary stuff. So I did mention this in survivorship, but I finished my last osteoporosis infusion last week. It was the last one that I was going to do. I actually ended up doing 2 more than I needed to because there is research around prevention of bone cancer with the same medication that I was taking for osteoporosis. So that was like a little bit of peace of mind for me too.
Yeah.
And then we've discussed this before, our date of remission and what that looks like, since I was diagnosed and did surgery first, but then I didn't finish treatment until January of 2020. I thought that my remission date would be after I finished radiation. However, and this kind of makes sense because you said that your date is after your surgery, right?
When they cut it out of me. Yeah.
So mine was also when they cut it out of me.
Okay.
So in April, I guess technically it'll be May, it'll be my 5-year remission date. And so mentally I thought it wasn't going to be until January of 20. I know.
Oh, here we go. What are we doing?
So this, and then I had 2 days later, I had an appointment with my therapist, and we've discussed this a little bit in the past as well, but like, we thought that getting to this 5-year mark, we'd be like, okay, we're so like, we're light as air, and this is great, and we feel so much better mentally. And like, I said to my therapist, I did celebrate initially, and I posted on TikTok like a video of me going to my doctor and like sharing this news, and I feel like, am I tempting fate by celebrating?
Interesting.
Like, am I going to go through all of these really happy emotions about like reaching this milestone and then just be devastated if something comes back? And so my guard is up, and I celebrated in that moment. And I was kind of like, I almost want to pull the post down. I kind of want to delete it. I don't want to look back and be like, wow, you were naive and like kind of celebrating too soon. But then also the argument is like, at what point do I feel like I can kind of have a sigh of relief and breathe? And like, I just don't know if I will ever get to that place.
Yeah. Wow, that must be tough. That was a lot to find out in a week. Oh my gosh, I can't believe I didn't even know this. I clearly didn't look at your full post. I'm so sorry.
It's okay. You don't need to. You don't need to, because we're talking about it now, which is fine. And also, like, that's not your responsibility.
Yeah. So, right. So you just have to decide in your head what feels right.
Yeah, exactly.
So where are you leaning towards now in this
So
moment?
I think it's hard too, because let's say, let's work out worst case scenario, and like my cancer does come back at some point. Am I gonna look back and be like, wow, thank God you didn't celebrate?
Right, true.
Or am I
gonna turn out a good time?
Right, or am I gonna look back and be like, you celebrated every single milestone, and you were present, and you lived your life as if, you know, it's not going to come back, and then it did, and then you handle it whatever way you need to. So yeah, I definitely had to talk through it a lot. Of course, in the moment, it was such a good feeling. The other thing too, and we talk about this often and always, just about body image, and like just now you were saying that you're out of shape, or you feel like you're out of shape, which I don't think that you are. Yeah. But when I went to the doctor, they do a full like blood panel before you can get your infusion. And when I met the nurse, she was like, your blood work looks amazing. Like, whatever you're doing, keep doing it. Yeah. And so on those days where I feel like I'm looking in the mirror and I'm like, I don't like what I see physically, like, it was such a good, like, great reassurance that I'm internally healthy.
Yeah, absolutely. And that is the best reward you could give yourself, hands down.
Totally.
And you're in osteopenia, not neurosis.
I know. So it felt really good. Like, all of those things were great. And of course, my mom was like so happy when I told her the news. And then this might have been like the best part of my day. This lovely gentleman, we were both sitting in the waiting room waiting to go back. And obviously, I don't know what he was there for, but if you're on the cancer floor, I assume it's something post-cancer or like active treatment. And he looked at me and he goes, I didn't want to say this before because I don't want you to think that I'm like hitting on you or anything. By the way, he could have been like my grandpa.
Oh,
and he was like, he said, you have the most beautiful hair I've ever seen.
Oh.
And I like almost wanted to start crying because, you know, you just go through such a journey with your hair, and it was such a big part of my identity for so long, and you get nervous, like, what's it going to look like when it comes back? And so I was like, thank you so much for telling me that.
Yeah, your hair is looking on point right now,
thank you.
Say.
But it was like such a nice compliment, and it really just like cherry on my day.
And clearly, right, you don't look like you've been through what you've been through. So for him to compliment and be like, yeah.
And then I just was like word vomiting. I was like, thanks, I just really like appreciate you telling me that because I lost it during chemo. And he was like, okay.
He's like, why'd I say anything?
He's like, just a thanks would have been fine.
Yeah, this is sidebar, but the waiting rooms during treatment and even survivorship are
hard.
Rough.
Yeah.
Yeah. Like walking in, I'm mentally preparing for the CT scan waiting room on Wednesday, but then also next week the breast center waiting room, because everybody in the breast center is at different points in their journey. Like I look around and I'm like, oh, she's way too nervous to be like she's probably new. You know,
Right.
I'm like telling everybody's story in my own mind.
I do that.
I don't know
By
if
the
that's
way,
weird.
no, it's not. I was just gonna say I do that in any kind of situation. Like if I'm out to dinner, I'm like, what are they up to?
Oh, I know.
Mm-hmm.
I'm super observant. I feel like I know what the table, like 2 tables down, is like talking about and discussing.
Yep, I am too. And when I was talking to my therapist, she told me, she was like, you are very observant of like your own emotion too. And all growing up, my mom was like, you were the person that was like very quiet, observing the room and then making a decision. And I still operate that way, like even if it's an internal decision.
Mm-hmm.
And so she was like, you have to check in on your emotions a lot before you can decide like what you want to do moving forward. Mm-hmm. I don't know if I told you this, but I talked to her about that medication that doctor suggested.
Oh, yeah.
I don't know if I'm allowed to say this, but she pretty much like had the same feedback. The first thing she said to me is, that's a really old drug for him to prescribe to you.
Yeah. And
like
a little backstory. Do you want
dated.
to tell a little backstory of the medicine and why you may have been seeking it out?
Well, and I told her this also. I don't know if I mentioned this already, if we talked about it. But my therapist feels like I have signs of ADHD, which I can kind of see now that she said it. Like when she was describing symptoms, it makes sense. In addition to my anxiety, and she was like, I think that it would make sense for you to talk to a doctor that could like formally diagnose you and potentially go on medication that would help you and then like help you sleep. She can't write prescriptions. So I went to this, I was like, needed a referral from a primary care doctor. I don't have a primary care doctor. Again, apologize if we've already gone over this because I feel like we maybe did a couple episodes ago, but regardless, I met with a doctor. It was like a 15-minute appointment. I feel like I didn't really get a chance to ask questions, and I'm not like knocking this doctor at all. I just like didn't feel super comfortable. And so he prescribed me a medication. I talked to Sarah about it because I'm like, I don't know, my gut is just telling me like maybe this isn't the best decision for me. And then I told my therapist, like, I'll follow up with you after I meet with this doctor and you can let me know like what you think, pretty much. And so when I met with her last week, she was like, yeah, like, I feel like your gut's right. Like, if you don't want to be on that, don't do it. I think that, and she ended up recommending a new doctor within the practice that could write a prescription for me. So I'm meeting with him in February. And I also ended up getting a thyroid test when I was there last week for my blood work. And, like, my thyroid was all in the green. You know how they give you, like, that scale of, like, red or yellow or whatever. I don't know what the number was, but, like, it was in the green, too, which I was kind of nervous about that. Where I was like, oh, my God.
What if your thyroid's out of whack?
Yeah.
Yeah. You know what's funny? I had my blood work done.
And did you look at it?
Pristine. My vitamin D level was low, which, welcome to OHIO. I haven't seen the sun in weeks.
I know, it's so depressing. I agree.
Like, please, like, maybe if I just, like, do a sun cutout and just put it in my room or something.
You know those
happy
like
lights?
I was just about to say that.
Yeah. Mm-hmm.
You should get one.
I should get one. I need it. So I started supplementing with vitamin D. I have to take a baby aspirin every day. I don't have to, but I do. I swear it helps with my lymphedema. Do not take medical advice from me, but my doctors cleared it, and they're like, sure, if you think it helps you.
So wait, but Sarah, did that make you feel good about like where you are in your health journey because of all of that too?
And I had my employee health screen that we do for insurance, and they measure like triglycerides and just overall BMI, and those numbers have gone down from last year. So it was super exciting. She was like, "You're doing great." I mean, the employee health person, so that was good to hear.
Also, like, you only have a couple more days of dry January. How do you feel?
Yeah, I neither here nor there.
Yeah.
Yeah. I mean, it's kind of nice to know I didn't miss it. I never craved it really. I still went to my social outings. Really the only thing is the guilt after like a night of having some wine.
Yeah.
I didn't have that the next day. So that was nice to not have to worry about like the guilt of drinking in regards to cancer coming back if you consume too much alcohol.
Yeah.
So that was nice to not have. It's actually a perfect time for my scan because I'm having it on Wednesday, the 31st of January. This is going to date this episode, but that's fine. And then I'm going out for date night on February 2nd. So dry January's over. Mama's gonna have some wine and celebrate her clear scans.
Get back into. So do they tell you like that day when you get scans?
No. So it always pops up on my chart.
Oh, I hate that.
Oh, let me tell you, I have gotten a lot of scans in my life, and I will say probably my ultimate worst my chart results coming back. I think I was going in because I was having headaches, so they did a CT in my head. So I was outside playing with Claire at the time. Ben was not here yet. Or maybe not even in the conception world, but she was like riding her bike towards the street, and I'm like on my phone, like on my chart, trying to read my results of my PET scan, and it was luckily obviously negative because I'm like, what if it would have been positive? Claire would have just went rogue into the road.
I mean,
so it's the my chart game is
it's a scary
game.
Yeah, it's like Russian roulette.
I'm like debating taking myself out to breakfast on Wednesday after,
you should.
Or I don't know what I'm gonna do, but
it's
gonna be
ordered
rough.
pizza and got myself some insomnia cookies.
Oh, after your scans or treatments?
Yep, after everything, and
this week?
It was last week, and then I forgot this part too. I don't get scans. Sarah gets scans. I don't get scans. They literally just like feel me up and make sure that everything feels okay. And I took my robe off, and before the woman even had a chance to look at me, I was like, I have a burn on my left side. And she was like, okay.
The word vomit that just comes out, I know. I feel you. I'm like, why did I
She was
say
like,
that?
okay, is there like, are you concerned about it? I was like, no. And so then she like, they like feel. And I was like, my armpits are really sweaty. I'm sorry. I was like, dude, shut up. Like, it's okay to not talk. I was not cool at all, or like cool, calm, collected.
Nervous.
Not me.
Nervous Brie. I'd never seen nervous V. What's called? It's the headphones. It's my naked ears, guys. They can't hang. I need them in their little muffins.
You've never seen me nervous? How about when I came in and showed you that burn, and I was like all out of whack?
And I didn't help you.
No, you did. You did help me. It's okay. Anyways, let's not go backwards. Let's go forward.
Yes, I agree.
Well, now what?
Survivorship. Okay, I have something to bring up.
Okay, go ahead.
Okay, so I was actually going to talk to my therapist about this because I saw a really, at the time, what I thought was a very inspirational message about not taking on like a victim mentality, right?
Okay.
And like working through it and being empowered and not taking on that victim role. But then I was like, okay, that's great. Yes, let's do it. Empowerment. But then I was like, what if you need to kind of go through that victim mentality for a hot minute to be able to process what's going on? Is the victim mentality always a bad mentality to be in?
No, I don't think so. I think it depends how I think it's a slippery slope, but I feel like it's warranted that like we've been through some shit and it sucks and I hate that for us, and like sometimes you just have to live in that for a minute.
Yeah. I agree. So thank you for validating that. Like, I feel like the victim mentality, I mean, do we even have to call it that? I feel like that's like, that even is a negative.
Yeah.
Like, we can have a pity party every once in a while.
Oh, I have a
for
pity party
ourselves.
for myself often.
I'm a queen of a pity party sometimes.
Yeah, like, hello, feel bad for me.
But then, what we do with that, we don't stew in it. We move on. We move on to do good things. But do we always have to be, empowered and on the path of survivorship? Like, can it ebb and flow sometimes?
It's just really tiring sometimes to always be positive. Well, there's a whole phrase called toxic positivity.
True.
And there's a reason for that, because it's like it's about finding the middle ground. If you're constantly like, everything's fine, everything's great, and not addressing how you actually feel, I think that can be scary too.
Yeah.
Almost as dangerous as being perpetually negative.
Yeah, I agree. So my husband's all about being neutral. Whenever there's a stressful event, I'm like, Phil, how you doing? He's like, I'm neutral. I'm like, okay, can I get any type of emotion out of you? Neutral.
If Switzerland were a person, it's Phil.
Yeah. He's really hard to fight with, if that,
That's I feel like that's good for you though, because I feel like you show your emotions and like you sit in your emotions in the best way. I think that's so healthy. And so imagine if both of you were like that.
Yeah, true.
I feel like that'd be hard.
He's my stable, shining rock.
Stable,
I FaceTimed him today. Oh my god, he's gonna kill me. And his head, he's bald, and his head was just glistening off the light. So it reminded me of like a shiny rock.
Stable, shiny rock.
That's
guy. Oh my god. I was gonna say like maybe a stable, shining like statue, like of somebody like that people in the square come to and be like, what a brave soldier Phil was.
There you go. He doesn't listen anymore, so.
Too hard for him?
Yeah. Oh, I know.
Okay, so this is a good segue. Some boundaries that maybe you set for yourself.
Yes.
Post, maybe, I don't really feel like I had any boundaries during. I was like, I'm just fighting for my life over here, quite literally. But post Cancer boundaries, whether it's boundaries with yourself, maybe boundaries with your relationships, have you seen any adjustments? Have you like actively set boundaries for yourself? Has it just come organically, or are you like, no, I haven't done anything differently?
That's funny that you said that. So I just feel like for me, I was diagnosed, new mom, and then, finished treatment, got pregnant with Ben. I really was just floundering.
Yeah.
Is that the right word?
Yeah,
floundering
it is.
A word?
Floundering
like a fish out of water trying to like get back in.
Yeah.
Okay, so I feel like I was just surviving. I really can't even tell you if I was setting boundaries. But more recently, when things have kind of slowed down, and I've had time to reflect, and I've been thinking about this year being my growth year, just having more boundaries with my self-confidence and being like, stop second guessing everything I'm doing, and like leaning into my decisions, and who I am is who I am, and feeling more confident in myself and my own boundaries and like who I am. So I would say for now, for like this year, I've been really just trying to be more confident in Sarah.
I love that.
Thank you.
I hear you, and I feel like sometimes I hurt my own feelings.
No.
Because I think that in survivorship, I like to believe I'm good and I'm not going to be affected by it. And so I almost like pick a scab and go down a path where I'm like, oh, this is going to trigger you, but I want to believe that I'm like better than it. And so I sometimes seek it out, and it's not healthy for me.
Okay.
And so I think I have a hard time accepting that I'm still dealing with the trauma of it all.
Yeah. So do you set boundaries then for yourself?
No.
And you just still go down the hole?
And I just hope that one day maybe I'll be okay.
You're like a gerbil. I'm the fish floundering, and you're the gerbil just digging everything up.
Everything. Digging it all up. And now I'm just like in a grave I can't get out of.
We're trying to be more positive in these episodes, and it's really not going well. Breeze in a grave. Dark. A dark hole of a grave.
Oh
I'm a fish out of water. It'll get better, I promise.
Oh my gosh.
It really backfired. It took a dark path.
It always does. I feel like I just like start out thinking it's gonna go a better way, and it just doesn't. Oh my god.
See, this is normal. This is okay.
Very normal. Okay, what about like boundaries in your like relationships or your friendships at all? Do you have those or no?
No. I mean, me and my best friends are like an open book.
Yeah.
We are, I don't really feel like I need to set boundaries. Phil's always funny. He's like, well, if your friend Julia or Darcy says something, you listen to them. But if I said the same thing, you don't listen to me.
It's
true.
It's because you're a man.
Yeah. And I'm married to you. I'm not married to them.
So
but
true.
no, I'm not really with family or friends. We just kind of are as.
I think that means you have really strong relationships. Have you heard of the fatal flaw in friendship theory?
Oh, no.
I got this from where I get all of my credited news source, TikTok. But I think it's really interesting, especially at the age that we're at now, where we've had long-standing friendships, I would say, and obviously some new ones too. But the fatal flaw theory is that every one of your relationships, your friends, whatever the relationship looks like, that person has a fatal flaw. And you get to a point in friendship where either you accept it and accept them for who they are and continue to be their friend and look past it, or you recognize that that fatal flaw is like a non-negotiable for you or something that you're not willing to compromise, and you adjust the friendship accordingly.
Interesting.
And so I think it is a really good way to look at it too, because it's like classic situation where you're in a group chat, right? And then like there's always another chat that like bifurcates off of it, like talking shit about somebody in the other group chat. And it's like, let's get to a place, and I want to get to a place in my friendships, and I am here now. I feel like this is also maturity where it's like that person is who they are. Like I'm 36, you're 35. Like obviously people can change, but to your core, like you are who you are, I feel like. And so I had to like kind of take an inventory of my friendships and my relationships and say, is this something that I'm willing to accept, and is it healthy for me? There were a couple friendships that I was just like, this is a lot, and I feel like I'm just kind of pouring from an empty cup as it is, and like it was almost like two people that were both very broken that were like trying to help the other. It's kind of like Clueless. 2 temps do not equal a license.
Ooh.
Yeah. Neither of us were like qualified to drive on our own.
So did the friendship end like as a mutual thing, or just organically fizzled out for you? And I don't know if you're talking about a specific.
I'm not necessarily talking like specifically. I think I just took a look at like everybody in my life and either like just reeled back a little bit on how much I was involved in that friendship, or I think no or in that statement. End of the sentence.
Yeah.
And I think that's okay too.
Yeah, I agree. And I think also when it comes to like getting feedback, or even people like with our podcast, and Phil, listen to me quoting Phil, talking about my man so many times in this episode.
I love that. Too bad he's not listening.
Yeah. He always says, never accept criticism from someone that you wouldn't accept advice from.
Ooh, that's a good one.
So just for me, like if it's, somebody that's a distant friend and I have feedback about something that I'm like, oh yeah, I understand, thank you for your feedback, but one in here and out the other.
I will not be taking that advice.
And I'm a very, very sensitive person. Very sensitive.
And are you good about telling somebody, hey, you hurt my feelings, or are you too proud to like actually say it?
Hit or miss. It depends on who it is. Yeah.
I also think that we're at a place in life too where if somebody, I should say it this way, if a friend came to me, somebody that I loved and cared about, and said, you hurt me with either what you said or what you did, even if I felt like I did absolutely nothing wrong, I care more about their feelings and like maintaining that friendship than needing to be right. Yes. And so if I am in a friendship or a relationship where the other person can't meet me there, and this is not me saying like, oh, like I'm a martyr and I care more about other people's feelings. It's just more like I love people deeply and I would never want to hurt somebody that I love. So if somebody isn't giving me that same respect, like that's also not a friendship or a relationship that I would need.
Yeah, I agree. So do you think cancer caused you to reevaluate friendships and more, or do you think that this kind of organically came with age?
Hard to say one way or the other. I mean, I've said in the past, like cancer definitely shifted my mindset as far as empathy. And so I think that I'm more understanding of other people. Mm-hmm. I think that and the reason I got in therapy to begin with, and again, I've said this before, so I'm kind of repeating myself, but like I just had a hard time expressing my emotions. And now I think that cancer kind of shifted the perspective of like, life is too short and I want to put my time into relationships that are mutually like supportive.
Yeah.
And so I'm not going to hold on to something and not say how I feel. I also think like it's confidence too, where I'm like, if I tell somebody how I feel and they're like, okay, I don't care, then that's not somebody that I need in my life either. Mm-hmm. You know, it's just like you're more willing to walk away from things.
Yeah, I agree. And I think that's okay. And then to be confident in yourself enough to be like, okay, I made the right decision. That's not serving me anymore.
Yeah.
Off I go.
Off I go into the sunset.
I did see a cool Instagram reel. Are those TikToks as well? Are Instagram reels TikToks? Are they one and the same? Because I'm old and I don't know.
It depends, I guess, if that, like, usually if somebody has a TikTok, then they'll just, like, post their TikTok to their Instagram, too. But I feel like a reel is essentially the TikTok of Instagram.
Okay, thanks. I just needed that clarification for any oldies that are listening as well. But I saw an Instagram reel / TikTok about people being in your front row. And everybody has a front row of people that are like exposed and see which, did I send it to you?
I thought you did, but I realized that Dana just sent this to me.
Oh, yes.
So we're all on the same algorithm, it looks like.
You let them in the good times, they let you in the bad, vice versa. You guys are each other's front row. So you like love each other unconditionally, and those are the people that you have that show up for you no matter what. Yeah.
I would say also if you are setting a boundary with anybody in your life and they're pushing back on that, also maybe a friendship that you need or a relationship that you should reevaluate.
Mm-hmm. I think if people aren't even willing to listen to the boundary, that's a red flag.
Major red flag.
Yeah. So they could at least hear you out.
And then they can also decide too, like, okay, well if that's a boundary for her, which I feel like it would be weird if somebody was like, oh, that's a boundary that I'm gonna walk away from.
Yeah.
I don't know, isn't that kind of strange? What are we even talking about?
Yeah, right? I'm so proud of us. Okay, so we talked about that.
What else is on our notes?
Let's see. Your dream about Maria.
Oh, yes. Well, first of all, I meant to talk about this like back in December and we kept getting sidetracked, but I'm not laughing at this, but my mom, it was like right after Christmas, right before the new year, came into the kitchen and my mom wears her emotions like pretty much on her face, I would say. And I could tell she was like really off when she walked in. And she was like, I have to tell you something. I need you to hear me out. And I was like, okay, what's going on? And she was like, I know, and I appreciate her for this. Talk about a boundary. She is very, I don't want to say sensitive, but she recognizes that I'm not in the same faith journey that she's in. So she said to me, like, I know that you don't believe in the same things that I believe in, but like, I just really want you to listen to me. So she had a dream that an angel came to her and said, you need to stop worrying about Brianna. I told you that she's going to be okay. And my mom was like, but Brianna's really anxious about it. And like, I hate to see her struggling with this. And so like, it's making me struggle with it. And this angel said to her, but I told you in October of 2019. So I was diagnosed in April of 2019. So this angel said to her in her dream, I told you in October of 2019 that she was going to be okay and that everything was going to be fine. And so my mom said to me, she was like, you need to know that you're going to be okay. In whatever way that you need to do that, like, I just had to share that with you. So then, my mom...
I have goosebumps.
I know, I kind of do too. I know, I do too. And so, my family, we take a lot of weight in dreams, okay? Mm-hmm. My mom has always had very vivid dreams, and about, like, people that have passed. So, when I was kind of going down this spiral after I got the good news at the doctor and I was like, am I tempting fate? All these things. I went to bed that night and then I had a dream about my friend, who was a friend that I've talked about before, who she passed away in 2020. And I have a lot of guilt with that because I felt like I wasn't there for her. Again, like kind of talking about boundaries, I had to create a boundary for myself where I was like, it's too hard for me to hear her going through this because like I had just got done with treatment. And I hadn't dreamt about her in a really long time. And she used to kind of come to my dreams a little bit, and it's been like probably 6 months since the last time I dreamt about her. It was a really random dream too. It was like nothing profound like my mom had. But then I woke up the next morning and I was like, Maria was in my dream. And is that telling me something? In a bad way? Like, is that like, like you were right to be anxious about being too excited about being in remission? So that didn't really help where I was mentally. And then I met with my therapist and I feel like I'm in a better place. But, and then of course, like everything with Claire too, where it's like these signs from the universe where you're just kind of like, okay, is that a coincidence? Like, I don't even know if I believe in coincidences anymore.
Yeah, I mean, God, my kid got me to move my skin up 2 months. So, whatever. I have no advice there.
I had a lot of people comment on that from the last episode too. Yeah, a couple people reached out to me and they're like, oh my God, Sarah's daughter.
Okay?
Yeah.
We'll find out, y'all. We'll find out. Don't be worried. It's fine.
Wellness check.
I'm already planning my party for 2 days after, so my skin is going to be clear.
Yeah.
Manifestation, y'all.
We love it. So, anything else?
No, I don't think so.
That was really all over the place, I'm gonna be honest.
Yeah, man, maybe you do need to go to ADHD meds.
I think I do, and
I'm just kidding. I'm totally kidding.
I feel like the headphone situation really
threw me off.
Threw me off too.
You can't hear me as good in there?
No. I actually feel like we're very loud. But I just don't understand what's going on, and I'm frustrated.
Yeah, that's all right. The people, if they want to keep coming back, they will.
Okay.
All right. Peace and love.
Peace and love. Bye.
Bye.
Peace and love.
How was it? What did we just talk about?
I don't know.
It was good.
I blacked out, and also the camera lasted the whole time, so that's good.
Did we black out?
We blacked out. I think it's fine, but